So let's continue with this September 2023, question number 162. Lateral angulation. If there is lateral angulation, medial collateral ligament injury. TURP operation, hyponatremia. 160 for question number 164, high output fistula after ileostomy, hypokalemia. Esophagus mucosal lining, non-keratinizing stratified squamous. Okay, keratinizing is not there. It is stratified squamous but non-keratinizing. Non-bleeding varices, telepressin, non-bleeding varices. Telepressin, octreotide or banding. Telepressin. Excessive normal saline infusion, hyperchloremic metabolic acidosis. Yes, someone is having. These are the notes. Oozing, arterial bleeding, rebleeding, anterior to perforate, posterior, gastroduodenal elastic, clip application, stop bleeding, injection, adrenal sclerotherapy, peptic, bipolar cortical, laser therapy, Sengstrom Blackmore. If cause of peptic ulcer, PPI, indication for surgery. Child with tension pneumothorax, initial manner, needle recovery, second maker. Management of arterial bleeding. Offer telepressin to the patient's bleeding. Stop treatment with definitive hemostasis at the time of treatment. First failed endoscopic treatment. Nerve emerges from the superior part of the psoas major. So psoas major superior, iliohypogastric, ilioinguinal, iliohypogastric. I think superior, it is anterior surface of psoas major, genitofemoral nerve. Now what is happening? The question is, if you see psoas major, this is psoas major, lateral cutaneous, that is femoral branches, and that is obturator, and iliohypogastric, ilioinguinal, genitofemoral. So this is all from the superior is iliohypogastric. That's why this is superior iliohypogastric, ilioinguinal, genitofemoral. Nerve related to psoas major. You see, this is the picture. This is genitofemoral. These are from the lateral sides. This is the anterior side. Femoral is also lateral and anterior, means in front, and they are talking about front. Anterior superior through the genitofemoral. So genitofemoral nerve is from inside, anterior. Knee extension and quadriceps contraction carried out by knee extension. This is knee jerk, muscle spindle. Nerve pierces external oblique and in front of spermatic cord. Ilioinguinal flesh mass bleeding is pyogenic granuloma. Woman after parotid surgery, asymmetry, dry face, absent forehead, wrinkles. Nerve injured is temporal branch, absent forehead. 30-year-old man cuts a corner of his lip while shaving. Few days later, purplish lesion appears at the site, bleeds and one of pyogenic granuloma. Man with the increased creatinine is increased and low calcium. Calcium is low. Dicholecalciferol vitamin D deficiency. J-wave hypothermia, bilateral inguinal lymphadenopathy, labia minora. Addison's crisis, hydrocortisone, fluids, hydrocortisone. Quick mnemonics for lymphatic drainage, again same. Patient at CT developing periorbital swelling. perioral swelling and hypotension, anaphylactic shock. Relation to plasma of insulin and 5% dextrose given to the patient. Of to relation to hypoosmolar isoosmolar hypotonic. It is hypoosmolar isotonic. Isoosmolar isotonic. 5% dextrose given to the patient. It is, this is important. Sodium chloride is hyperosmolar. No, normal saline. Sodium chloride is isoosmolar isotonic, and sodium glucose is isomolar hypotonic. Glucose 5% dextrose. If 5% dextrose is added to sodium chloride, then it becomes hyperosmolar. Relation of normal saline is normal saline is isomolar isotonic, and glucose is hypotonic. Osmolarity is same but hypotonic. Glucose is hypotonic, isomolar hypotonic, isoosmolar hypotonic. That option is not there. Fluid rate of 24 kg. 24 kg. So it is 4 to 1. First 10 kg 40, next 10 kg 20, 60, 68, 64. So this is hypoosmolar. 55-year-old man is receiving IV fluid, 5% dextrose in water along with insulin. If it is along with this insulin, after glucose 5% is metabolized by insulin solution, the osmolarity drops. So it becomes hypoosmolar, making it hypoosmolar compared with plasma once metabolized. So when it is given with insulin, it becomes hypoosmolar. Hypotonic. Hypotonic is definitely there. Hypotonic. Isomolar is there, but it becomes, when given with insulin, hypo, it becomes the following are accepted normal daily requirements of surgical patient. Sodium, potassium, nitrogen, carbohydrate. Okay. Paralytic is a potassium required 70. Loss of dorsiflexion, eversion, dorsum sensation, common peroneal. Positive predictive value is prevalence. Aortic aneurysm histology showed medial necrosis, cystic wall, connective tissue disorder. Smoking and next peripheral shadows, ground glass appearance, small cell carcinoma. During dumping, insulin increase hypoglycemia. Microscopy, pink amorphous material is amyloidosis. Red-green Congo amyloidosis, lower motor neuron flaccid, Clostridium difficile intestinal, deep ulceration reaching muscularis propria, ulcers, Clostridium difficile, ulcers, ulcers, fibrin deposit, ulcers having fibrin deposit. Bilateral pancreas, sarcoidosis, bilateral system. Cushing triad causes bradyvagal tone is increase. B. Parotid gland surgery, nerve injury, can't wear earrings. Greater auricular nerve is injured. Superficial. So this is greater auricular nerve. Earrings. Auriculotemporal. Positive pressure measure decreases end-diastolic volume. Friends had a party second hour after diarrhea, staphylococcus aureus, constipation, morphine, mu receptors. Patient traveling sub-Saharan Africa, bilharzius, squamous cell carcinoma. Fistula between sigmoid and ileum, 5 years student, diverticulitis. Fistula with ileum is okay, Crohn's disease. Lung lesion, adipocyte, fat cartilage, hamartoma. Paraneoplastic syndrome of the lungs, parathyroid. Hyperpulmonary osteoarthritis syndrome, squamous cell carcinoma, hormonal malignancy, pancreas tumor, hemolytic uremic syndrome, E. coli, recurrent UTI, new stones, protease, smokers with dorsum ulceration, Buzzers. Hypovolemia and after fluid challenge, still oliguric. Fluid challenge, oliguric means urine to plasma, urine specific gravity, increase urine osmolality. Urine osmolality is 250. Still oliguric. Urine osmolality. Urine specific gravity osmolality. Blood out of aorta after one cycle, 70 clostridium per gram positive rod. 70 years suspicious of inflamed intervertebral disc, Stafford, yes. 70-year recovery room, 27% oxygen, decreased pH, increased PCO2, reduced sensitivity is due to chemoreceptors. Femoral artery is located at midpoint, mid-inguinal point. Sodium potassium, example of active transport patient with pancreatitis, experience carpal hypocalcemia, Pringles maneuver, gastroduodenal ligament. Indication for renal replacement, high potassium, ligament that provides support to uterus, transverse cervical or transverse perineal. The confusion goes on. Prevent uterine ploys during vaginal delivery, try an eye. What is the most important now? Again, this question was so much discussed. $213. Stop. here.